My name is Dr. Ryan Scott. I'm a chiropractor. I've been practicing since 2009, and my clinic, interest in sport background, we started working towards concussion, sport-related concussion, and so that kind of started us down the path, working with people with traumatic brain injury of all different varying degrees. A lot of the people we were working with were getting better, but there's always those people that were getting stuck. And like any chiropractor, some of the practice deals around motor vehicle accidents as well, and so that's the population we were dealing with. From a personal perspective, I just got an interest in neurology and brain injury through a condition my father's dealing with, and so I started doing different research, reading up on things, and learned about the PoNS and its development at the University of Wisconsin, which by coincidence is where my wife went to school. So I got a chance to follow up and meet the developers of the device and tracked it down, and then sort of followed Helios's journey to bring the PoNS to the public. The nice thing about the PoNS is it takes us from a place where we couldn't go before. We had a lot of patients that got better, as I mentioned. However, there are a lot of patients that got stuck, and it's not just our clinic. We're treating people that are coming from all around now, and they were getting stuck in their treatment. You get that sort of quote in the notes, maximum therapeutic benefit, where they're basically being told, this is your new you, this is your new life, this is where you're going to be from now on. And I belong to a few Facebook groups for people with traumatic brain injury as well, and that's sort of a prevailing sentiment that goes on in these groups, is that this is the new me. I've been involved in an accident, my concussion or traumatic brain injury has me stalled, I can't walk properly anymore, it stops them from being involved socially, all these types of things. They can't go out, they can't participate in life like the average person would. So now we have this opportunity in the clinic, and we see that. We're seeing that with the patients that we're seeing. Several of the patients that we're looking at, they were coming in, they're struggling to walk a straight line. They can't walk with a friend and hold a conversation because they can't turn and walk at the same time. However, with a very brief amount of treatment, they're all of a sudden seeing changes in that. And so, it's so gratifying as a therapist, as somebody who's treating patients, to be able to know that we can be that sort of beacon of hope, that that person that's been told this is as good as you're ever going to get, well, we now know that there's something more that can be done. And the big thing is, to take action. As I mentioned, I see people in the Facebook groups and they're suffering. They're out there, they feel alone. I see a lot of isolation. People have retreated into their homes. They're away from their people. This injury of traumatic brain injury affects not just the person, but their spouse, their significant other, the person in their life, their children, their grandparents, their parents, whoever they're caring for. The damage is widespread, and it's so important that people see that we can make a difference, that they can get their life back on track. Give us a call, we'll move you forward, we'll get you back on the path that you were meant to be on.